Welcome to the CSPSC podcast. Thank you so much for joining us today, Le-Tien. My name is Jeffrey Wong. I am the co-lead for local initiatives at the Canadian Social Prescribing Student Collective. So why don't you give us a little hi, my name is, and what you do?
Yeah, for sure. Hi, my name's Le-Tien Bhaskar. I am currently a health policy PhD candidate at McMaster University in Ontario, studying social prescribing. I've been part of the social prescribing world for quite a few years now, but I think here the most relevant role I have had is one of the co-founders of the Canadian Social Prescribing Student Collective. So thanks for having me. Super excited to be here.
Amazing. But for those of us who are perhaps newer to this world, what is social prescribing? How would you define it in like one sentence?
Yeah, that's a great question, and a lot of people are still answering that. But social prescribing is essentially a catch all term to describe the work of connecting people to relevant social and community services to address non clinical needs. There are various definitions out there that exist but it really does mean different things to different people. And I'll stop there. But yeah, it is just referring people to community and social services to address non-clinical needs.
What would be like, do you have an example of like how it actually works like in practice to make it click a little bit more maybe?
Of course. So sometimes social prescribing is done within the healthcare system. So it could be a physician, for example, who
Mhm.
is doing a social prescription. And so what happens is that usually in an appointment, a physician may recognize that someone is experiencing um, either food insecurity or difficulty accessing services. And so a physician would then connect them to a link worker. And so a link worker is kind of a core component of social prescribing. The idea is that for physicians, they don't have the time to get to know your life story. Unfortunately, that's just how our system works. Usually, doctors have like 10-minute appointments and they have to
Mhm.
go through it really quickly. The idea behind a link worker is that there is someone dedicated to providing or giving patients the time to learn more about them. So, a really popular adage you'll hear with social prescribing is shifting the narrative from what's the matter with you to what matters to you. And the link worker's role is really to have that conversation, the what matters to you conversation. And so when so say a doctor recognizes someone is experiencing, let's say they have diabetes, usually a doctor would tell them you need to work on your diet. And that's
Mhm.
really easy to say, but once someone leaves the doctor's office, it's really hard to follow up on, especially if they don't have money for food, they don't know how to cook uh, like healthier foods or whatever it may be. Maybe a healthy diet isn't really culturally, or our conception of a healthy diet isn't like culturally relevant for them. And so those are just some ways that a link worker can sit down and dig deeper and understand what are your barriers and how can we address them with resources that already exist in the community. So they may connect them with some programs. There are really great food prescription programs where people get like baskets of fresh foods. There are cooking classes people can be referred to, and there are also services that help you get access to more culturally relevant foods and those ways as well. So social prescribing really is a catch-all term to address like the other determinants of health besides your biology and physiology.
Wow. And I think that's really powerful too, because like, yeah, you mentioned the diabetes example. Like people would immediately think, okay, like HbA1c, those are kind of the outcomes people are looking for. But there are
Hmm.
also kind of the deeper layer to like the social or structural determinants of health that people often overlook. The system often overlooks as well.
Yeah, and I think there's this discussion within how our healthcare system, or at least in the West, we have a very biomedical approach to health. And as our population ages and conditions become more chronic, we really had to move upstream, right, to more preventative approaches
Mhm.
to health. And so social prescribing is kind of a tool to embed that within an already biomedically dominant system, right? Like we recognize that maybe our system needs to change. Social prescribing has been described, and I love the description, as a Trojan horse. So you're
Mm,
putting it in there to say this is one tool to help your patients with like these other maybe auxiliary services, but it starts the conversation, right? Of like, why do we need this? Why do we need these services? Why are these so important? And then it kind of builds from there to hopefully help people recognize that social and structural determinants of health need to be embedded within our system. Um, so yeah, it's not a cure all, but it is a starting point.
yeah. I'm curious where your work actually falls in all of this, because you mentioned you're a PhD candidate at McMaster. Yeah,
Mhm.
how does your work intersect with social prescribing? Very curious to learn.
Yeah, I think so. My work is really looking at how social prescribing is conceptualized. So, like I said, a lot of people have different definitions of social prescribing. Social prescribing as a practice isn't new at all. So, when you talk to other people, they're going to be like, "Oh, I already do that." Like when you describe what
Mhm,
social prescribing is, and that's kind of the point. The idea is that this work is already being done, often off the side of people's desks. What we want to do, or what social prescribing really aims to do, is put that more in the forefront and
mhm,
recognizing that this work that you may be doing, that you may be thinking is kind of frivolous, it's not. It's really important. And when we have a term to it, people can share their stories about social prescribing. People can actually talk about it. It's not this amorphous like practice that people know that you're doing, but, if
mhm,
you don't have a word for it, it doesn't, it's really hard to, like, measure, for example. So, my work is really looking at how has social prescribing, uh, being described in some practices, and also I'm pausing here because I'm still trying to figure out what my work is about. But it is looking at social prescribing as a policy. So really understanding how can social prescribing that started off really grassroots in Canada. So we
mhm.
start in Ontario, started off as the Alliance,
Yeah.
in British Columbia started off in United Way. Um, how does it spread across the country? And there are so many different questions out there of, do we want it to be taken up by government like it is in the UK? Um, in England, where it's like embedded within their national health system? Um, or do we want to keep it grassroots? Because when it's grassroots, uh, it's really built by the community for the community. And there's a beauty to that that might not be able to be replicated if we were to hand it off to higher like jurisdictions, for example.
Hmm. What would do you see it trending that way? Like kind of it being more handed up to a higher jurisdiction, like health authorities taking it up, provincial governments, maybe even like
I mean, that's something I'm learning about too. We do see examples of it. So like, and it's really interesting because there is examples of like provincial support. So in British Columbia, for example, the Ministry of Health in British Columbia is funding social prescribing just through United Way. And that's great because there is recognition of how important that community sector is to social prescribing. Because the health system is only half the equation in social prescribing. You can't do
Mhm,
social prescribing without a really strong and robust community sector. Um, and so there are examples of that. It's really difficult to say what is best because, or what it's trending towards, because we have like different health systems essentially, right? 13
mhm.
functionally independent health systems
Yeah.
across the country. And so they're all kind of leaning towards different directions, and sometimes they're healthcare adjacent.
Mhm,
So in Alberta, it's not the Ministry of Health, it's ministry more focused on communities and aging. We have examples of, well, in Canada, a lot of social prescribing is leaning towards aging just because that's a
mhm,
priority population right now. But I wouldn't say that we're trending towards social prescribing being picked up by provincial governments. I think we're kind of in flux of like what priorities are with provincial government. So right now it's really being spearheaded by the community.
yeah.
And whether or not people want it to be taken up by the government will have to be on a province or territorial basis. It's just really the big pull, like why we want it to be taken up by a higher jurisdiction, is because we want sustainable funding. Um, and that is everybody's question, and that is everybody's like, how do we do this? And we're still figuring that out.
Yeah, you mentioned sustainable funding. Would you say right now it's more scattered then? Like it's more like pilot project kind of thing here and
Kind
there?
of here and there. Some places have like embedded it within their everyday practices. So, like for Alliance, so the Alliance for Healthy Communities is the organization in Ontario uh, that represents the community health centers. And in 2018, they were the ones who first piloted social prescribing. Um, the pilot or like the funding for that pilot ended in around 2020, but they're still like continuing the practices. Maybe not in as like rigid of a way as they did in their pilots, but they're still embedding it because it just made so much more made so much sense for them because the community health centers, like social prescribing is what they were always doing.
Yeah.
Um, and so with that, they also have found other funding to support other projects like the social prescribing for better mental health, Black focus social prescribing, but those were also pilots.
Hmm.
A lot of the social prescribing projects across Canada are like philanthropically funded. So not some government support, but like a lot of like just donors, really. And so yeah, that allows for flexibility in how social prescribing is implemented, but yeah, the sustainability is really a concern for everyone, I'm sure.
Yeah. It's going back to social prescribing. How did it actually kind of came to be? You mentioned like how it started in Canada was like the Alliance kind of pilot
Mhm,
project in Ontario.
mhm.
Where was it kind of first conceptualized or in your work where you found maybe?
Yeah, for sure. So, social prescribing, the term itself, was coined in the UK, and it's kind of been scattered across policy documents since the 80s. Um, But in 2019, it was formally introduced in the National Health System in England
Hmm.
um, as part of their Universal Personalized Care Plan. The report was called the NHS Long Term Care Plan or Long Term Plan or something along those lines.
Hmm.
But the idea was that doctors would be getting funding to hire link workers either within their practices or like to have a partnership with the volunteer sector, volunteer or charitable sector, that's what they call it.
Hmm.
Um, and so it's really interesting how they did it because it was part of their GP contract. So the general practitioner contract. So you needed to have a link worker in your practice somehow to receive this funding. And so that was like a huge break in the case for social prescribing in the NHS, and it has been recently renewed again, I believe last year or the year before, more recently again, which is great. And so they've committed to hiring around like 20,000 link workers or something.
Wow.
Um, over the years, and they've been meeting that. And so
Hmm.
that's where social prescribing was initially implemented within a healthcare system. And we see it all over the world now. We see it in Singapore, we see it in Japan, we see it Canada, America, Australia. So there's tons of examples of social prescribing around the world. Like I said, social prescribing was first formally piloted in Canada by the Alliance for Healthier Communities. They received funding from the Ministry of Health in Ontario just to pilot it. And so that's how that started. And they it, piloted it around, I don't recall exactly how many community health centers, but they had community health centers like representing different populations. So they had one that was French speaking, they had one that was more rural, more urban, but that's where they did their pilots, and they were able to do that until 2020 with the funding, and that's where the final report came. At the
Mhm.
same time, in BC, that's where social prescribing also started. They started at similar times, but they actually didn't have anything to do with each other. British Columbia's social prescribing emerged as part of the Better at Home programming in United Way Lower Mainland at the time. And so it also was just a way to put it to improve the practices that they were already doing. And so since then, social prescribing's kind of grown across the country. We see it in Alberta, we see it in Nova Scotia, I believe, Saskatchewan, now New Brunswick, I believe, but it's Quebec. It's growing all over the place in like small grassroots efforts. So when I say grassroots, I mean like one clinic maybe practicing, or like a group
Mhm.
of clinics or organizations maybe working together. But yeah, that's kind of how social prescribing's emerged across Canada. And then, oh wait, I guess it's important to mention in 2022, the Canadian Institute for Social Prescribing was established. And that's really great because it kind of represents like a national interest in social prescribing. And so what CISP, what we so fondly call it, what CISP does is really they are the national platform for social prescribing. So they're not doing any implementation. They're really just trying to coordinate. So since there's so many different practices and Canada is quite a large country, they're trying to coordinate different social prescribing practitioners across the country to just share what's happening and trying to create like a national voice for social prescribing. Um, and yeah,
Wow.
and today.
No, that's amazing. And 2022, you mentioned that's when CISP, or the Canadian Institute for Social Prescribing, started. Around the
Uh-huh.
same time, the student collective, the Canadian Social Prescribing Student Collective, the CSPSC, also started. Tell us more about that.
Yeah, so the CSP, I know it's always a mouthful. The CSPSC see it. Yeah. Started in 2022. And it started with myself and two colleagues, so Caitlin Moole and Lifa Aaron. But we were all grad students at the time.
Mhm.
Uh, Kate Mulligan, who is a supervisor or a committee member for both Caitlin and myself, connected us because when Caitlin and I were first doing this, we kind of started in isolation because at the time social
Mhm.
prescribing wasn't a very like commonly known word. So like we were both experiencing the thing of like, oh, what's your dissertation about? It's about social prescribing. Oh, what's that? I've never heard of it. Things like that. And so for a time it was pretty lonely not having anybody to really talk about social prescribing with.
Mhm.
Um, so Kate kind of connected us together and we started the Canadian Social Prescribing Student Collective. And I believe we were building upon or we were inspired by the student champions model in the United Kingdom at the time. And it's really interesting. So in England at the time, they had the student champions model, which was really cool because it was medical students who were really advocating for social prescribing. And so they had this pretty elaborate structure there where they had like champions in each medical school and they would go off and talk with their peers about social prescribing. But for us, because neither of us were medical students, but we were both very interested in social prescribing, we really wanted to represent social prescribing more holistically. So when we created the collective, we were thinking like, let's include everybody who's interested because social prescribing really spans uh like different disciplines and really I think personally I believe that's the beauty of social prescribing. We had
Mhm.
students from arts programs, we had public health students, we had science students, uh and all of them were able to find themselves within social prescribing. And so that's where we started off with the collective at that time. And it was a very small but mighty team, and I'm really happy to see it continuing to grow as we both have stepped away from it. Um, but yeah.
What do you think is the main, like, at least like back then, what was the main kind of purpose of the collective? I think you mentioned like the more obvious part was to like connect people who are working together in that same space and also like maybe building a bit of awareness of it here in Canada as well. Is there anything that you think? there's more potential that could be like with the student collective, like what it could do, maybe.
Yeah, for sure. Like, I think a big part of it, at least for me, was I really believed in the power of students, because it was really interesting. I was speaking with somebody from the UK, like the student champion program in the UK, and he is currently a doctor, but when he first started it, he was a medical student. And he was
Mhm.
sharing how it's really interesting that people are a lot more eager to listen to a student talk than even a doctor talk about this. So I think students really do have quite a powerful voice. And so when we're talking about the student collective, sure, we're trying to raise awareness about social prescribing, but it's also to motivate students. First of all, to recognize that they have a place. I remember being an undergrad and not knowing where I'm going to go after undergrad, and not really seeing anything of interest like the traditional path of, if you're a science student, you go to medical school. If you're arts, you go to law school and those things. But there's
Mhm.
just so much more out there. And so really seeing yourself and these other like movements across the country I thought was really important, and also for student advocates I really believed that students had a place in sharing what they believe they should be in their curriculum. For example, we have part of our work was really understand was trying to advocate for like social prescribing to be included in like medical school curricula, but also like social work or any health related disciplines. Like it should be taught in schools, because that's when you're talking about changing a system, you start with the students, you start with the new ones, because sometimes others, older people, are too stuck in their ways. So we always start with the students when we want to create a systems change. And so that's really the power behind students. Like when we were starting, we had so much enthusiasm and we did so much, I think, again, based like fueled by passion, because we were not funded at all. We did it all based on like we all did it all voluntarily, but like students went out and tried to and advocated to have social prescribing implemented on their campuses, and some were successful. We had students go out and talk with their profs about social prescribing, and were invited to talk in those classes because they were interested in learning more about social prescribing that way. We have student published papers. Again, everything fueled by passion, which was, I think, again, that's the power of students. I would love for it to not just be fueled by passion, but um, yeah, who else is going to do it besides students? Because as someone who is, I mean, I guess 1 foot out the door of school right now, it's like it's really easy to get overwhelmed with other things. But when you're a student and you're kind of like bright eyed and bushy tailed, everything's like, yeah, the world's your oyster. And so, really uh, exciting times for students to do that.
Wow, the power of students.
Yes.
Yeah. And you guys also publish, speaking of papers, I think you guys published a commentary on this as well, on the Student Collective in Public Health Agency of Canada's journal, HPDCP. Is it Health Promotion and Chronic Disease Prevention Journal?
Yes, that sounds right. The lead author was my colleague Caitlin, and that was a very practical step by step description of what we did. We did a lot of things, but it was the idea behind that paper was just to say, this is exactly how we did it, because we were at a point where sometimes students from other countries were asking, how did you start the collective? And that was
Mhm.
super cool. And so that's what that paper is all about. When we're talking about, like, I want to say, I always use the language of like aspirational things, like why students should be involved with this. Like again, about the passion for students. I think that's something that really can only be heard or felt when participating in these things. So we do have a paper out just talking about how the collective started. But I think if you really want to know more about how the collective works, it's just joining it and like being able to talk to students. Like we would have never connected without the collective. And I think that's so wild. There's so many people I work with now, and it's like without the collective, I like know students from across the country, and that's super cool. So yeah.
100%. And I've like personally know students who got jobs connected to professors and all of that because of the collective too. Didn't even know this area existed. And now this is like maybe their PhD thesis, what they're doing. um,
Yeah, and that's so cool. Sorry, go ahead.
no, no, no. Yeah. Speaking of aspirations, what would be one hope that you have for the next generation of change makers in this space?
Oh, what a great question. I am personally a huge advocate of the community side of social prescribing. And I think a lot of people join social prescribing because they recognize the importance of community. And so I think one thing that I would love to see more of, especially with students, is them getting more involved in the practice of social prescribing. And it, like when I say community, it's like often in students, especially in universities, we're kind of confined to our campuses, and then we graduate and leave the community. But when you take a step off campus, there is an entire thriving community there, and it's really amazing. I remember, so I went to U Waterloo, um and then you're in your own bubble. But once you, and I currently live in Kitchener, right next to Waterloo. So the community here is really amazing. And you don't really get to see that sometimes as a student. So for students who are interested in social prescribing, and I think this is something a lot of students are probably interested in anyways, going out to your community, learning what's around you, because social prescribing is all about community. Uh, or asset-based community development. So like learning what strengths are in the community. Um, when you do that, you're kind of opened up to not only like work in social prescribing, but there's other things out there that you don't really know exist and you don't really know the importance of until you actually see it firsthand. So I would love to see more students go out and like volunteer. Maybe they don't say social prescribing, but getting more involved in the community um, is great not only for you but for the community that you're living in. And I would also love to see more students uh, be more vocal about not only social prescribing as a practice, but everything else that social prescribing kind of represents, right? Moving towards a more holistic approach to health, uh, advocating for the importance of, again, community in healthcare, things like that. And yeah.
Yeah, amazing. And no, I think that's so important too because we are kind of in a world where we're more connected than ever before. At the same time, the opposite could also be said that we're very disconnected from one another. We don't know what's in our community. So I think this is a really good approach, like not necessarily through social prescribing, but also just like getting to know your community, what assets are there, what's available, how you can get connected. And yeah, I think that is really powerful.
hmm And I think for students, like the reason why I got into social prescribing, like way back when, very upsetting to say, but when I was an undergrad, was because I was experiencing my own like mental health crisis at the time on campus, and I was telling the story earlier, but essentially what happened was I was in second year, usual existential crisis of I don't know what I'm doing with my life. And so I had a doctor's appointment to talk about mental health because everybody on campus was like, oh, campus healthcare is or campus wellness is there for you if you need any kind of support. And so I was really like working towards that appointment as like kind of like my goalpost at the time. But when that day came, there was some administrative error, and
Uh,
the appointment just never existed on their books, and that was
uh,
devastating for me.
yeah.
Um, and so that was like my first and hopefully last panic attack, but I felt so lost in that point. Um, and so that was kind of like when I stumbled upon social prescribing, it just made so much more sense where people don't need to depend on this healthcare system. I'm not saying that you shouldn't depend on the healthcare system, but there are other sources of support out there. And especially as a student, especially when loneliness is such a huge epidemic right now, being able to find support and even those places where you don't expect to is really important. Like, social prescribing was a cool project I heard about in undergrad, and now it's literally become my entire life. Like, it's hard to run away from, but uh, you'll find community in like the strangest places sometimes, and it's so important. So it's not only like great for the world and whatever, but it's great for you as well, I think.
And that's the beauty of it. Well, thank you so
Yeah.
much for joining us today, Le-Tien. Really appreciate your time and all that you've shared with us. And for all of us who are watching, listening, if you'd like to get involved, that sound interesting to you, you can join us, become a member at cspsc.ca. We're also on Instagram and Blue Sky, also at cspsc.ca. Is there one takeaway, final word to wrap up the whole thing? Kind of difficult.
Uh, that is really difficult. One takeaway. Uh, I think, one takeaway I think for anybody who's listening is there's always a spot for you. And again, it doesn't have to be social prescribing, but I will say for this specifically in the student collective, there's always a spot for you because you bring something important. Whether it's something you think is completely irrelevant, like computer science or whatever, there's there's a way, and that's again, that's why social prescribing is so exciting because it's bringing everybody together to help each other. So yeah, that's my final takeaway.
Amazing. Thank you so much, Le-Tien.
Thank you so much for having me.